Hello, good afternoon, everyone. My name is Jenny Lee, and I'm a third-year nursing student. I am here with my nursing peers from Queen's University, Michaela, Clara, Crystal, and Nathaniel. And I also have my nursing peers from University of Ottawa, Hyan, and Samaya. And together we'll be presenting our passion project, CHARM, which stands for Cultural Humility, Addressing Racism and Microaggressions. And we also have our faculty members who have been supporting us from the start, Mona, Marion, and Jane. Racism, discriminations, and microaggressions experienced by underrepresented nursing students contribute to a loss of confidence and feelings of sadness and anger. These experiences affect the students' academic performance and personal wellness. There is a need for innovative and accessible resources that provide instructions and promote critical thinking regarding racism and microaggressions in the classroom and clinical setting. The aim of the CHARM project is to provide a toolkit for nursing students regarding how to respond safely and effectively to microaggressions.
Next, we'll talk about our project's learning outcomes and chosen framework. We use literature to guide the definitions included in our module. We will provide students with an educational component prior to playing the virtual simulation games, also known as VSGs. Prior to creating the simulation game, we consolidated learning outcomes for the VSG, which are listed above. Our virtual simulation game has 4 learning outcomes, each centered around equipping students to feel empowered to stand up for themselves. Throughout the VSG, we will use the 6-step approach framework. The steps of this framework include ensuring the patient is clinically stable, addressing the comment made, refocusing the conversation onto the patient's health, sharing perspective, reminding patients of roles, and temporarily removing learners from the environment. We decided to go with this framework because it is clear, effective, and prioritizes patient safety as well as personal safety. Next up, we have Crystal and Nathaniel presenting the components of our project.
Thanks, Jenny and Michaela. Next, we're going to talk about the website and the modules. Overall, our goal with the website is to create a resource hub and a safe space to learn about microaggressions and how to address them. The layout would be visually appealing and user-friendly to navigate. The homepage would include basic information like the background of the project with their mission statement, purpose, goals, and information on the team members. From the homepage, it would also be very clear and easy to access resources, such as the pre-learning modules and the virtual simulation games themselves. The pre-learning module would give students baseline knowledge about cultural humility and microaggressions. For example, they would learn about race, discrimination, and equity versus equality. They would also learn about theoretical models like the 6-step approach to addressing microaggressions and understanding factors like the bystander effect, which can influence how people react to microaggressions. Other resources would include resources about microaggressions that are catered towards a general audience, as well as academic articles. Finally, there would also be a contact page for any questions related to the project. Next, I'll hand it off to Nathaniel.
Thanks, Crystal. So I'll start talking about the virtual simulation games. Eventually, the goal is to have a game for nursing students to play and other games for clinical instructors to play. At the moment, we're focused on making games to teach nursing students how to deal with microaggressions in the clinical setting. Afterwards, we plan on making games for clinical instructors to learn ways to support nursing students experiencing microaggressions. Simulation games put the student through various scenarios where microaggressions are executed by various people like patients, nurses, peers, or instructors. Players can choose which scenarios they want to experience. The player will be presented with 3 responses to choose from at multiple points in each scenario. The situation will play out in a video and the student will be briefed on the pros and cons of each choice. There's a rationale for the best answer, but no absolute answer is provided for each decision due to subjective nature of the situation. Additionally, how we play out the scenario may not be how it plays out in reality. Our goal is to enable students to address microaggressions in a way that results in the best outcomes for them. For example, they might seek support from their friends or their clinical instructor. It might not always be realistic to address the microaggression. Games can either follow linear or circular reasoning based on the 6-step approach outlined in the pre-learning module. Linear reasoning games are straightforward and allow the student to apply the six-step approach. Circular reasoning games call for more critical inquiry on how to appropriately respond, as the six-step approach is not applicable to every microaggression encountered in clinical settings. Games are a safe environment for students to make mistakes and develop their toolkit for handling microaggressions. This will hopefully prepare them for situations in their learning environment and practice. And finally, we have Hayan, Clara, and Sumaya.
Hi, everybody. So this is our planned evaluation. The evaluation process takes place throughout the student's learning experience, from the pre-learning module, in which the students may complete, to the virtual simulation games. In the pre-learning module, we currently have 6 learning outcomes that focus on the student's comprehension of the content and prepares them for the virtual simulation games. For example, after the pre-learning module, students will be able to define key concepts, begin to identify the different forms of microaggressions, and differentiate between acts of racism, discrimination, and microaggressions, and understand the 6-step approach framework. Students may engage in reflective practice about themselves as a practitioner and with peers on issues in healthcare and nursing practice. Lastly, students will be able to refer to safe practices and the use of nursing, psychosocial, behavioral, and developmental resources. Students will be able to apply what they learned in the module in the virtual simulation games, and there are also a set of learning outcomes for the virtual simulation games as outlined previously by Jenny and Michaela. Overall, the learning outcomes help ensure that students are gaining knowledge and clinical decision-making skills on cultural humility, racism, and microaggressions that they may experience as a nursing student in their clinical practice.
So I'll be talking about the challenges that we faced as we work on the project. A challenge we faced while working on the CHARM project was being able to make a simulation game that was culturally appropriate for everyone. We want to represent each culture ethically accurate and not fall into the cultural stereotypes. Inaccurate depiction of specific culture or falling into stereotypes will do a lot of harm. In a journal written by Diane Lalonde titled "Does Cultural Appropriation Cause Harm?", she mentioned how misrepresentation and falling into stereotypes may cause non-group members to view the group stereotypically. It can also influence the group members to view themselves and the group in a stereotypical manner. Cultural representation is important so marginalized groups will feel seen and validated. The essence of the project is to provide a safe space for these groups and population. During the creation of the simulation scenarios, our mentor, Dr. Sahani, brought up an excellent point that many did not consider. How are we going to choose the names of our player in our simulation game? What makes a name Indian and what makes a name Chinese? In order to address this issue, we will make a consultation with the ethics board to ensure that the names that we select is ethical and an accurate representation. We will also consult a cultural advisor at Queen's University in order to provide a culturally sensitive space. In order to create a game that was culturally appropriate, we decided that it was essential to have diverse team members, as it will help us face each challenges from different perspectives and adjust them accordingly.
Finally, we have our next steps, which includes finalizing and completing both the virtual sim games and the website. We hope to refine and finalize the virtual sim games and complete the filming for them. In order to film these, however, there is a few things that we must tackle. These include finalizing the script, which includes consulting with the ethics board and the cross-cultural advisor in regards to the names of the characters in our games, which is what Clara said. We would then need to recruit some actors to film the simulation game. However, due to the COVID-19 pandemic restrictions, some tasks aren't able to be completed. But we do aim to start these processes as soon as the provincial government permits us to. In addition to this, we hope to complete the website by incorporating all the aspects listed previously in a seamless interface. Thank you for listening to our presentation.